he was saying our goal. Oh yes, thank you, Kimia, for remembering. We want to make this available after the conference as well, so I hope everyone's okay with being recorded. Um, so our goals and objectives for the workshop today is to put together, explore the events that have led up to the current overdose crisis. Maybe try to understand what are some of those events that have led up to this point. And then also to discuss the impact of COVID-19 and how that had affected rates of overdose, at least for what we know in BC and in Canada. And then also, we'd like to talk about some of the parallels between COVID-19 and overdose. And obviously, the two are very different, different disease, different mechanisms. But at the same time, I think we can draw from it some main domains that are similar and interesting to discuss. Our objective really is to hear the different perspectives, and that comes from your voices. So we'd love to have more participation from all of you. And then together, as we through discussion, we can work to coming up with ideas and inspire each other on how we should move forward. So first off, here is a graph that is taken from the BC Coroner's report. And this data shows the gradual increase in rates that dates back to 1995 of illicit drug toxicity deaths and the death rate per 100,000 in the population. Now, we've always seen that there was cases of overdose, but what was really escalating and causing a rise in the time point of 2015 to 2016. There are many different ideas behind that, but there definitely were prescription opioid probably causes issues of heroin entering the market in larger volumes. And that was probably that upwards trend leading to what we see in the 2015 to 2016 and 17. Then up to 2018, so at 2016, BC had declared an emergency as a health crisis, an overdose crisis. A lot of, harm reduction factors and measures were taken to try to mitigate this rise and change. We did see a drop in 2019, probably due to many factors, which I want to explore together as well with you in a discussion. But just briefly, we see that drop in 2019, and then this very large rebound and concerning increase there in 2020, which is especially driven by the months following when COVID became an issue here in BC, so after March 2020. And then here in 2021, that reflects the numbers up to the end of April only, so that's why it's dropped there. But if we see these continuing trends from what we see in 2020, the numbers of 2021 should definitely surpass last year, upwards of over 2,000. All right, so I'm going to actually move into an opportunity for us to have some conversation. So I think Kimia will lead us in discussing this next question.
Yeah, so we were, we are seeing kind of these multiple different waves of increases in overdose rates in the province. And we were kind of interested in your thoughts of what you think was the possible driving factors for the dramatic increases that we saw in 2015 and 2016 that ultimately led to that public health declaration of emergency in the province. So, feel free to unmute and share your thoughts or put it in the chat. I also have the Whova chat open here, so if you're more comfortable sharing there. Yeah, so Mackenzie is saying changing drug supplies, especially introduction of fentanyl. I do agree with that. I think changing drug markets were definitely a big shift during that time, starting around 2013, and then leading up, we saw kind of a lot of lacing of heroin with fentanyl and contamination. Abigail mentions domestic production. Definitely, I know a lot of kind of what's making it really difficult as well is that the formulas of the products are changing a lot rapidly as well. So it's really difficult to tailor treatments to these approaches as well. Any other thoughts? Yeah, so I think overall, the changing drug market was the big driving factor at this point in time. And mainly not just the changing drug market, but also the inability of the healthcare system to respond to it. So our healthcare system wasn't adequately prepared to take on such a rapid and quick change in the drug market. And I have Tracy mentioning homelessness. So yeah, rising numbers of homelessness, I think, can definitely impact accessibility to healthcare and programs. So that was definitely associated as well. Yeah, anything else? Any other thoughts?
I think to add into that comment about like the drug supply, maybe introduction of fentanyl, I do know, like in the beginning, like when we were seeing that drop in the numbers in 2018, there was a big movement to, for example, set up drug testing sites, testing kits, so that people can, see if there is fentanyl in what they're using. They can decide then in terms of whether they need to change the amount, or just having that awareness that it was a drug sort of toxicity issue. And I know that some like a drug poisoning, people weren't aware of what was in the substance that they were taking. Although I find what's interesting is we are hearing more recently that fentanyl has become a drug of choice for a subset of the population, and that has a concerning change, and that it goes from by recognizing and also providing safe supply, testing the drugs, and that would reduce overdose. Well, that wouldn't quite really serve the purpose if people are choosing fentanyl, because that's really what they're looking for as well. So like in Vancouver, in emergency rooms, we do have people coming in who are on and have been using high doses of fentanyl as well, like illicit cases. And so when they need to go through the substitution program and withdrawal management, it is quite difficult to even approach that from a treatment perspective when fentanyl was a drug of choice and when they've already been using high amounts of fentanyl. So that's something we've seen, and it's concerning. And I'm wondering, within our participants in the areas where you're working, if you've also kind of witnessed fentanyl being a drug of choice for individuals. That is not, for some, it's not really a toxicity or poisoning issue. Does anyone have comments about that?
So I can offer that in my area of Northern Ontario, it's definitely a drug of choice. In fact, to the point where if people didn't know ahead of time that they were using fentanyl and found out through drug testing, would it change their consumption? And what we're finding is that people are actually saying it probably wouldn't change it much. So the belief before around increased awareness has shifted, because now that is exactly, people are looking for fentanyl. I think what we're seeing, at least again here in this area, is fentanyl with benzos, and that people didn't necessarily know that benzos were part of the fentanyl that they were purchasing, which of course is a concern for overdose, right? To have benzos in that mix.
Mm-hmm. Absolutely.
Yeah, I got to echo what Abigail has been saying. And that's sort of evidence in our EMS call reports as well, where at least like maybe a year and a half ago, people were saying, well, I overdosed, or I was poisoned on heroin, or I was poisoned on such and such. But now people are actively saying, no, I was poisoned with fentanyl, knowing full well that substance was in what they were taking. So I think people are much more, I think they just all assume that fentanyl is in everything at this point.
Do you I would say
Oh, sorry, Mackenzie. Didn't mean to interrupt you. Go ahead, please.
I'm gonna pop on that too and just say I think the issue too is that there really isn't many other drugs available, especially in the area where I'm located in Peterborough, as well as in Northumberland County that I specifically work in. There really isn't any other opioids on the street that's available. It's only fentanyl. People are like, oh, be saying like, oh, I think I got heroin today, but like it doesn't really exist in our area. So unfortunately, people don't really have a choice in the matter at this point. Like if you have an opioid dependence, like that's the only thing that you're able to get at this point. So therefore, people's drug of choice is very limited, I would say.
Mhm.
For sure. And we see that, a lot of the concern is coming from the potential of fentanyl and other powerful opioids being in stimulants now, whereas people, if they're using like or down, they're assuming that fentanyl is in it. However, nowadays that we're seeing that when people are using, say, crystal meth or crack cocaine, they're making the assumption that this is free from fentanyl, when in reality that may not be the case anymore. So we're seeing a lot of overdose calls being driven by those sorts of assumptions.
Mhm. We are seeing like another wave of stimulant use as well, and the trouble is there really is no treatment to address stimulant addiction, and I think that is a long awaited process of not having any therapeutic at least not pharmacotherapeutic approaches, and that has definitely been an issue. Okay, let's see. So here I have a slide here, which was an idea presented on kind of how there were different waves of opioid deaths and overdose deaths, and how that was sort of triggered by different kind of major events. So the first wave that was recognized is that there was a rise in prescription opioid overdose deaths, and that started over 10 years ago, 1999, or 20 years ago now. And then the second wave was sort of around 2010, and then we saw the rise in heroin overdose deaths. Then the third wave began in 2013 with synthetic opioid overdose deaths being reported and recorded. And so 2013 was, when that probably the process started, but we didn't really see that immense rise there until probably between 2015 and 2017. And then I think a fourth wave has been discussed, which is now the prevalence of stimulants being the market, and the combination of stimulants with opioids, and then fentanyl as well mixed in. And now I'll kind of revisit this graph that I had shown earlier, but just sort of look at sort of the last 2 years, or at least from 2020 to 21, and sort of what is happening there. And I think there are quite a few experts and also those with lived experience who are able to share what they think has been the drive behind these increasing overdose rates because of COVID, and how COVID has impacted people who use substances in so many ways. And I just wanted to allow us to probably talk about sort of the understanding of people in terms of what is happening in terms of COVID, and then what is also happening in terms of overdose. So as comparison, I mean, obviously the two are such different illnesses and diseases, but the awareness of the public to COVID, of course, has been very high. The concerted effort to prevent the spreading of COVID, to do everything they can to protect the vulnerable, is widespread. And yet we don't see the same, of course, for addiction, and in terms of trying to work together to reduce overdose. In comparison, for the numbers of death, and probably for this audience, you're well aware that despite all the attention efforts we're putting into it, for example in BC, the deaths from COVID are still much lower than what we've seen within 1 year of what we had with overdose deaths. And so that's maybe it's the stigma, the lack of public awareness, but quite a few factors. So I think I want to move into a chance for us to then talk about what has been affecting people, and especially certain subpopulations more so during COVID. So Kimia, you can present this question and see what we have there.
Yeah, so like Fiona said, we are interested to hear your thoughts on which subpopulations you think are kind of experiencing this increase in overdose deaths during COVID-19, and why that might be. So how do you think COVID-19 might have impacted the situation, so that we're seeing rises in overdose deaths? Okay, so Tracy mentions that being Indigenous, having a history of trauma, homelessness, and aging out of care could have all contributed. I definitely agree with that. I think before COVID, there was definitely limited access for the populations that you mentioned in terms of accessing care. But with COVID, this access dropped significantly from what it was. So we saw a decreased capacity in a lot of the treatment programs to kind of implement social distancing measures and kind of follow public health guidelines. And this reduced kind of capacity for both harm reduction and treatment access for the population significantly. And then Mercy is saying using alone due to COVID restrictions has increased overdose cases in the downtown east side. Definitely, I definitely agree with that. A lot of the public health measures that we were seeing were kind of geared towards people that were not using substances, and they were going very much against what we recommend to prevent overdoses for people that use opioids. So we know that one of the biggest risk factors for an overdose is using alone or in isolation, and the public health measures were encouraging that. So it definitely could have contributed. Mackenzie says people in shelters and precarious housing as well. Definitely, again, we had both reduced capacity, and I also remember was having a discussion with a friend of mine who's an EMT, and he was saying that when there is an event of an overdose in like housing facilities, a lot of people were kind of stepping back from the person instead of kind of going forward to help them out, just because they were worried that they might be infected with COVID, and they tried to distance themselves. So not being able to provide that immediate help right away definitely would have impacted the situation. And then no quick access to treatment. Yes, of course. So as mentioned, there was difficulty in accessing treatments prior to COVID, and that just got worse with COVID. Yeah, again, using a loan, not being able to access programs, definitely. So I guess just to add, a bit of a thought on this. So in BC, there was a supervised consumption site that reduced its capacity during COVID from 24 to 6, which is a significant reduction. And during COVID, the province also saw kind of the number of people accessing these supervised consumption sites decreasing by about 50%, which is a lot. When we are seeing that, this kind of points that it leads to increases in substance use related harms, because accessing these harm reduction services is no longer possible for everyone. And then in addition to that, we had all of the border closures and business closures and everything, which also contributed to a changing drug market. And I believe someone mentioned previously that we are seeing an increase in local or domestic production of drugs, and that definitely would have increased during COVID. And then in addition to that, we know that COVID and the isolation, it would have caused a lot of mental health problems for everyone. But if someone is using substances, chances are they are more vulnerable to these underlying mental health conditions. So that would have been more exacerbated during COVID, which would have led to potentially riskier substance use behaviors and a higher likelihood of overdose. So a lot of different factors going into kind of increasing overdose rates during this time. Anything I missed, Fiona, that you'd like to touch on?
No, I think you've covered it all, and I think also our participants have, mentioned the key areas of concern. Mm-hmm. So, as we've, as everyone shared and Kimia has shared that, I think what was the issue was treatment was insufficient, prior to COVID, that we see a lack of continuity of care. And also substance use treatment had very low retention rates even before COVID. So there were, the system was still trying to figure out what to do. There were, different measures that, was trying to, people were taking, but, clearly it still wasn't enough. And I think what COVID was, did at the time was really highlighted all the social and clinical factors and the health disparities that were already existing and had sort of just highlighted and made it, had much more significant impact on those who already were vulnerable and marginalized. And I think, as someone has mentioned, with race and ethnicity, we do see reports on race and ethnicity playing a part in COVID infections themselves, in those who were, how the disease was spreading, and not regardless of substance use, just in COVID itself, and that the opportunities for example, working from home, from isolating, like a lot of different measures that were taken to prevent the spread of COVID also are highlighting the risks that those who are in marginalized populations, cannot take, and that they would have a greater chance of contracting COVID as well. So I think that the race and ethnicity issues run true in both diseases. And then in treatment, and also in access to treatment, and appropriate treatment was highlighted as being insufficient. And in fact, what was already an insufficient system had further reductions. So I guess if we summarize it this way, we shouldn't be surprised that we see this large escalation in tragedy and in deaths. And I think this goes to some large systemic issues, and that if we are sort of discussing action and change, it's across many different systems that need some work, not just in the emergency healthcare aspect of things, but all the way upstream to prevention, early intervention. All the different approaches need to be in place to, I think, make a change and a difference. And then in the clinical factors as well, that there are health conditions and health issues that also are affecting those who use substances. And I think it goes probably both ways, is that people who use substances may be more likely to also be infected with COVID. And we don't, it's very difficult to really tease those apart and to try to dive into understanding that data. But I think if we could understand a little bit better on how the vulnerabilities of each population play into the infection of the disease, that would be helpful. And another factor that I think is quite important that Kimia just mentioned as well is the mental health and mental illness that is prevalent and also a pervasive and an important aspect of addiction treatment that is definitely in the evidence. It's recognized as being a vital part of treatment, but it's not necessarily addressed. And I think, as so if most of you were in the previous session with Dr. Gabor Mate, he definitely has worked very hard to share his perspectives on the fact that we cannot fully understand addiction if we don't fully understand that there's coming from a place of trauma. And I think that rings true, and had also been kind of highlighted during COVID with the isolation, with all the effects of that on people's mental health. So I think that it would be helpful to understand how there were shifts in overdose rates through the last few years, before COVID and after. And I think coming from
more of a research place of mine, I would like to be able to look at, if someone were interested to really pull this data apart and to see how maybe there were location shifts or regional shifts before and post or pre-COVID, and to see how that might have changed the likelihood of overdose and also overdose deaths, whether it's moved sort of from private residence to outside or more into private residence because people were isolating or no longer, kind of socializing or in peer groups, if that was driving some of it. And I think we have data from the coroner's office, and I think for each province within Canada at least would have some of this data that we could, look at in more detail to understand some of those shifts and drives, and whether if there's kind of prevention programs that we could put into place to once we understand these changes a little bit more. I think we would like to also discuss some of your experiences and concerns. And Kimia has a couple questions that she also wants to lead here.
Yeah, so we thought this would be a good place to kind of discuss what might be some potential approaches to mitigate the crisis that we are currently seeing and that it's continuing to escalate. We are starting to see a drop in COVID-19 cases, but we're curious to see if you think the impact will be the same on the opioid overdose crisis. Do you think it's going to decrease with the decreasing COVID cases? And if not, why that might be the reason? So yeah, just an open discussion. See what everyone's thoughts are. And feel free to unmute yourself if it's easier. I think this one might be a bit of a more convoluted topic. Might be easier to unmute and talk about it.
Yeah, there's a lot in that one for sure. But maybe what I'll say is, again, looking at Thunder Bay as an example, we were hit with quite an outbreak here within the street and homeless population in Thunder Bay, and became a hot spot across Canada when that occurred. And I think some of the creativity, but also the quick response, was to make sure then that those who were either precariously housed or were living on the street, that they were the first to get the vaccination, even though it didn't fit in with necessarily the government protocol. So I think it's, again, this regional approach to understanding our communities and what needs to happen. And why I bring that up here is that for many of those individuals, they were not accessing our safe consumption sites due to the fact that, again, the isolation, and then with getting the vaccine, it actually increased our numbers again, where people were using safer places and not necessarily using alone. I think the challenge as we move forward for your second question around, as COVID decreases, what happens? And I think, and this has been talked about here, it's been talked about in earlier presentations, but I think how we've really exacerbated people who have lived experience in their trauma and their addiction and their mental health through COVID and the isolation and lack of connection, that we do have a lot of support required of us as we move ahead. So I think we're still going to have a big impact. I think we need to be ready for it and to be able to approach it in really dynamic and creative ways that meet our region. So I'll leave it there. Thanks.
Mm-hmm. Thank you.
I think that the pandemic has really shown the disparities in health outcomes, disparities in homelessness, drug use, addiction, and I like from where I'm working in Peterborough, I think it's really at like a turning point of whether or not that this is going to help to make things better in Peterborough or not, just because it's so it's just been very visible. Drug use, addiction, like our overdose rates are the highest they've ever been in the city. So I think that this is kind of a turning point, and we're hoping that with more services like ours and other community partners, that we can actually reach, the higher level people who actually can make these changes. But unfortunately, I don't think without our higher level people at this point that overdoses are going to, the rates are going to drop. It's also a policy issue, which I know it's a very large topic in itself. But Peterborough is we just had a conditional approving for our safe consumption site. So we're just waiting on the next step for that. So hopefully with that, that will help with the overdose piece. But yeah, I really think that this needs to be a team effort with many different services and supports in all levels of it, from community to, the higher government ones. Yeah. Thank you.
Thank you.
I really do agree with some of the points Mackenzie just made, and I find it really interesting in that there's a lot of effort from our end, kind of in the addiction research, or people working with individuals, kind of putting forward to try to combat the crisis right now. But it's also really interesting, and we will talk about this from like some survey results that we have, that awareness regarding the issue is quite low around overdose compared to COVID. So, kind of reaching those higher level that you mentioned, to like be able to really bring about nationwide or province-wide change. Really, one of the biggest barriers that we have is that there's very the awareness regarding this, the overdose issue and addiction, is much lower compared to COVID. So a lot of people are concerned with COVID and the number of COVID cases and deaths, but while overdose seems to be a lot more extreme in all the provinces, there's just very little discussion around it. So one of the things that we kind of discussed was talking more or raising more awareness, but also educating people more about what is happening beyond just what is interesting in the public health perspective of COVID.
I think that adding to that,
yeah, go ahead.
Adding to that, we don't have quick access to treatment services in northern British Columbia, in particular Prince George. There's these unrealistic conditions for individuals to access detox, for example. And so if a person is wanting to make some changes in their life, the system, the policies do not allow that to happen. So as was mentioned briefly earlier, that we need to see some public changes in terms of how individuals can access detox. And our goal here in the north is to, we're in the process of wanting to construct a treatment center to deal with addictions. And we're looking from a holistic approach, where we're not only looking at medical, but also traditional, bridging those two models together. So on that same breath too, at the provincial level, we really do need to see increased education for medical professionals, doctors, and nurses who provide services for individuals, in particular where areas where detox is supposed to be available. Because you might have the facility available, but if you don't have the professionals who are able to provide that service, then it's really ineffective use of space and a disservice to individuals who need the supports and services, especially detox. So our goal is to increase detox beds in northern BC.
Yes, and thank you for sharing that, Tracy. And I think, in addition to then after the period of detox, there needs to be a really good continuation of care, right? And that needs to be in place and allow, it's a long trajectory. So I think it can't be just sort of bits and pieces. You need to, have all of that in place in order to properly serve people.
You're absolutely right, Fiona, and that's exactly what we're doing. We're also applying aftercare supports and services. That's our goal. Yeah. So we're looking at a care facility where we're increased our number of beds, because right now the Carriers Canada Family Services does provide seasonal treatment, and we're wanting to expand the beds from the existing 14 beds that we provide for May till October, and provide all year round services. Increase detox beds by at least 10 in northern BC, and provide aftercare for up to 10 to 15 spaces for individuals to transition into a future for their life.
Thank you. Thank you for your comments. Okay. Well, as you know, maybe some others will want to, you know, continue to share with us some of their thoughts on action and sort of what to do next. I'll move into just sharing with you some results from a survey that we had done. And we had wanted to sample those who live in BC and sort of ask for their opinion on what they feel is the most urgent issue and how to approach it. And this survey was also kind of created to understand what youth and those who kind of just recently graduated high school, what they had learned in school and what kind of substance use and addiction and mental health information that they had received. And I think that because, you know, our group really wants to also work upstream, look at early intervention and prevention, I think to sort of understand what is happening currently now in schools, you know, helps us better cater our solutions to them. So we had worked with a polling company, and the total sample was 659 people. And we had split the questions, and we asked 3 different age groups. We had adults 25 and over. So that was a larger group of 400 because we wanted to cover, you know, a larger span in ages. And then we had a group between 18 and 24. And then we had a group of those who were currently attending high school between ages of 12 and 17. And then we also sampled or did our poll in 6 different provincial regions. So we tried to cover the different areas. So we had City of Vancouver, and then we had those who represented Metro Vancouver. Then we had Southern Interior, we had the North Coast, Northern Interior, and then in the Vancouver Island as well, and the Southern Coast. And then we had the Greater Victoria area. So that was our representation. And in terms of gender, we had it, you know, quite balanced between men and women as well for the 3 groups. So we had asked people whether, for one, their awareness that there is an opioid overdose crisis, that it was declared as a public health emergency in 2016, and also the number of fatalities that had occurred since then. The awareness of that number was quite low, you know, like about 20%, that they were aware of those numbers. And when we asked, you know, whether people within their social circle had experienced or had known someone who suffered from an overdose, we found that 29% of young adults, so these were those between 18 and 24, actually said they had a peer who had a drug overdose. And then 38% of the adults 25 and over had known someone personally also who had an overdose. And I think when we first saw these numbers, we were quite surprised. It was higher than probably what we had expected, knowing that the numbers of overdose are high within the province, but sort of with the mindset that they were concentrated in certain areas. But when we pull, you know, the entire province with different regions, it really is something pervasive and really has hit hard, you know, close to home for many. And unfortunately, those who had suffered from an overdose, only about 24% of them were actually in treatment. So that highlights, you know, some of the factors we had talked about earlier about access to treatment, accessibility, and even the appropriateness of the treatment, right? Because, you know, not one treatment can work for all. And I think that is also a problem in substance use and addiction treatment, is that retention rates are very high because some treatments just don't work for individuals. And then in terms of awareness of overdose deaths compared to COVID, and this is something I think we would expect, that COVID really is, you know, a global issue. And so the awareness, you know, would be very high for most people, and it's all constantly talked about on the news. So, you know, that makes sense. But in comparison, the awareness that there's a crisis, an opioid crisis in BC, there's still, so we look at, that's the green bar, which are those who are aware of the opioid crisis. Fully aware, we have about 35%, then somewhat at 47%, and still 17% were not at all aware, you know, as they themselves said, that there was this crisis. And then we do have a large amount of the public, 58%, who felt that the public health response to the drug overdose crisis is inefficient. So I think if we are able to kind of work with public opinion, further. That's another way we can, speak to the policymakers as well, kind of to bring not only evidence, which I think has been presented time and time again, but also kind of the drive from the public and from citizens. And now another piece we were really interested in was to understand what a level or amount of knowledge was being given in school, and how much in terms of students who were in high school, how aware they were about high-risk substance use. And we are seeing a decreasing age in terms of the number of overdose cases, and those in the lower age range. Those numbers are kind of higher, and lower ages, we are seeing overdose incidents as well as deaths as young as 12 and 14. And so definitely the high school period, I think students are exposed at least to this news and this information through social media. But in terms of content on how to kind of address this with an informed kind of evidence-based way, I think it's quite low, because for youth who are enrolled in high school, about 30% said that they really haven't learned given any content about different addictive substances, at least from teachers in school. So they're learning about it maybe elsewhere. And we also asked people if they were to, interact or see somebody who might be having a drug overdose, would they be even confident in figuring out whether that's happening or not, or recognize symptoms. And a large percentage, so including the not very and the somewhat, so the kind of turquoise and the blue pie charts, that together is close to 80% really saying that they would have no idea. They wouldn't be able to recognize it, and to probably do something about that. And then the next pie chart over is about asking whether these students are aware of any ways that someone who uses drugs can actually decrease their chance of overdose. And again, the don't know and knows, make up a large part of the population of, 70% saying that they wouldn't know what are ways to reduce chances of an overdose. So I think that this knowledge and this information needs to be accurately presented to students in school. I think in a informed way, not in a abstinence-based method of prevention, which I think has traditionally been the approach, and has been shown that it doesn't is not effective and it doesn't work. It needs to be informed decision-making. And so in terms of prevention programs, I think most young adults who had recently left high school, and even adults, are supportive of the government making prevention a larger part of the curriculum, of kind of highlighting high-risk substance use and overdose, making it a priority, and potentially spending a larger budget on that piece of education. So I think that's helpful to communicate to policymakers. Okay, and this last slide here, and just to add, these poll results are available as a PDF. So the report has been done, and that website from Interchange Foundation, which was a non-profit organization that helps sponsor this report, it's available on their website. So all the data, as well as some of the personal comments from participants. And so the majority of youth in high school stated that they would want a program about substance use and mental health, and that they would also want a more intensive program in high school. So I think if we ask those, who are, in that population group, who are those who probably need the early intervention, they do want this information. So I think that substantiates some of the action that we should take. Okay, and that brings us to our conclusion slide. And I think this has been brought up already by a couple of people in the audience. And really, we need to focus on many different systems. That's a cross-system approach, that we need to work on treatment in many different ways: the availability, the access, the appropriateness, timely treatment, and continuity of care. I think that all of that goes into the treatment aspect. Awareness in public, which I think is a big of the piece of that, is the stigma that still is prevalent for substance use and also for mental health, and then the concurrent disorders and then more education and potentially prevention and early intervention all need to play a role. And so Kimia, do you want to add to more of this before we end off? I think we still have about 10 minutes. And also from the participants, it'd be nice to kind of chat together about our next steps.
Yeah, I think you pretty much covered everything. I definitely think that early intervention and prevention is very important for youth. And right now we are not really seeing much work being done in like for youth in pretty much any country. So I think that's particularly important in preventing overdoses down the line. And of course, as you mentioned, like a lot of the countries that we see are doing better with regards to overdose and substance use are the ones that are providing both timely access to treatment and also treatment options. So having the ability to choose what treatment you receive rather than having no choice as to when or how you receive the treatment, I think is really important for this population. And I think, as Tracy mentioned, this population is already so vulnerable. And when they finally, decide that they're in a place to get that treatment, we don't meet them where, where they are. We ask them to wait and until we are ready. And I don't think that's fair in the way we are approaching the treatment. So yeah, these are just some thoughts.
Mm-hmm.
Does anyone have any kind of final thoughts to share with us or questions?
I think in British Columbia that the coroner's report can do more than what it provides. I think that more can be done in that area. That totally goes towards awareness. Because if you want to go down the lane of prevention and early intervention, then those are critical tools and resources that we need. As much data as we can collect and make it publicly available. It's one way to begin prevention and early intervention.
Yes.
And if we had a coverage of what we did with the COVID crisis, about how many deaths we've had and how many hospitalizations there were and how many people were dealing with addiction and how many deaths there were, I think people would be appalled. And I don't know what it'll take to open up the media's eyes to see that this is a crisis that's percolating and is going to continue to percolate during and after the COVID crisis.
Yeah. Yes, I agree with you that that the level of information that is shared is just it's so minimal. I mean, we see some numbers reported, but for example, we don't know the data on how many overdose events there are, and that's not accurately recognized or kind of collected. And those who do receive naloxone, for example, what is their aftercare? I think many people who suffer from an overdose fatality had overdosed many times prior to that. And I think those numbers are staggering as well if they are shared, because I think if they are shared, it highlights the failure of our treatment systems. How can somebody suffer from so many different overdose events, so many of them, and yet not be given appropriate care and treatment? So yeah, I think that a lot of work needs to be done, and in order to increase that awareness and maybe to request for that kind of information to be collected and to be shared.
It's a multidisciplinary response too, right? It's not only medical and health to do the response. It's the role of the RCMP, it's the role of our federal and provincial counterparts, because it's not just a Prince George issue or a BC issue. It's nationwide.
Mhm.
I think Allison has an interesting question about how we can educate healthcare providers more. She says that in her prior experience, she realized that a lot of people with lived experience were kind of hesitant to attend hospitals or other services due to mistreatment, and to see how we can better educate our healthcare providers. I personally think one of the big kind of changes that need to happen is with regards to the education that they're actually receiving in training. So I know I have a lot of friends in medical school who mentioned that the addiction kind of training that they get is so minimal to almost non-existent. And if you want to know more, oftentimes it's optional. So it's more of an elective rather than a kind of part of the actual curriculum. So I think that's and that's the issue pretty much at every education level, I would say. So you see it in medicine. You know, I have studied both at an undergraduate and graduate level, and that's how it is. And same in high school. A lot of these programs are either not available, or if they are, they're oftentimes optional. And when you are in programs that have requirements for you to complete, and certain courses don't provide you with those requirements, a lot of people just don't take them because they'd rather take courses that fulfill requirements. So I think that's one of the big issues that we have personally, but I'm not sure, Fiona, your thoughts on this.
Yeah, I think that's, you know, on many different levels. Definitely for those who are working in the midst of this, I must say, I think there are those who work tirelessly to be advocates, you know, who are frontline workers and who recognize the need, and who are big champions for having this change. Unfortunately, there are also those who are in roles where they could be making a big difference, and yet they do not recognize the importance of addressing trauma, for example, in the people that they see. And you know, maybe it's also in terms of looking at approaching someone in a more, you know, holistic way, and also in a historical way, that the person is not their addiction, that they are someone with other experiences, with other childhood experiences, with other family systems, you know, influences and dynamics and experiences, and that this is just sort of one piece that, and one point in time of which you were interacting and trying to treat them or work with them. But if you take a step back, there is a whole history of other events that have occurred. So yes, I think that the distrust for a lot of individuals with the healthcare system, and for example, going to emergency room, I know, like earlier I mentioned about those who suffer from an overdose, and they probably don't end up in the ER, right? If they had a naloxone reversal, they often would prefer not to go to the hospital and not to receive further care because of their previous treatment there, and not appreciating the stigma and also the type of care that they will receive. So yeah, I mean, short of better education and awareness for all professionals, I think we have a lot of work to do. But I also want to sort of commend those who are at the front lines and who have been, you know, working with all their compassion to make this better known. Yeah.
So I do think the next block is starting at 2 p.m. So thank you so much, everyone, for attending. This was a very educational discussion for me personally, and I hope for a lot of you as well. Yeah, I think if you have any further questions, you can reach us on Huva still after the program. So feel free to message us there. the chat stays open on the workshop, so feel free to ask further questions there. And yeah, thank you so much for attending.
Thank you. Thanks, Kimia.
Yeah. Right, well,
Okay. All right, bye.
rest of the conference.
Yeah, I'll see you back in the next one.